Part of this conversation. Today, we have our presenter, one of our own, Dr. John R. Bolden, Jr., who grew up here at Cosmopolitan. Dr. Bolden is currently the infectious disease specialist at Morris Hospital in Morris, Illinois. As the first and only infectious disease specialist at Morris for the last 15 years, Dr. Bolden is well respected for his unique expertise and dedication. Before applying to medical school, Dr. Bolden worked in biology and microbiology laboratories at the University of Illinois at Chicago for 2 years. Dr. Bolden graduated from the University of Illinois Chicago College of Medicine, completed his residency at Mercy Hospital and Medical Center, and the fellowship at Mount Sinai Hospital and Rosalind Franklin University of Medicine and Science. Dr. Bolden has been a tremendous resource for so many, especially during our COVID-19 crisis and beyond, says Aaron Kaltowski, Healthcare Center Director of Operations. Dr. Bolden has worked tirelessly during the pandemic and was recently recognized by his colleagues and featured in the monthly newsletter at Morris Hospital. He and his loving wife, Laura, are the proud parents of son Darian and daughter Madison. Dr. Bolden is the oldest son of our members, John and Laura Bolden, and the older brother of Michael and Andre. Please help me welcome Dr. John R. Bolden, Jr.
I just want to thank the church, Nursing Guild, Reverend Compton, Mrs. Janet Jackson, too, for inviting me to talk about COVID-19 considerations for the communities of faith. I'm going to go over some COVID facts and some COVID mitigation strategies to help facilitate opening the church up. So let's get started. Some basic safety actions that I'm going to talk about. I know they've been pounded by, you've read them and probably also on TV. Okay, that's good. Okay. First, mask wearing is just an essential component here to mitigations. Everyone should wear their mask out inside, especially in crowded conditions. I know the CDC and the state have sort of relaxed or lessened their mitigations. So, but I think personally, and then from a professional point of view, the virus is still out there, so we should definitely wear our masks inside, unless instructed to. So another important point is avoiding poorly ventilated indoor spaces, making sure that your heat, ventilation, and air conditioning system has been inspected, it's in order. Also filters, making sure the indoor filters have been recently changed. And then in addition, whenever someone is is sick. I know the culture from a professional and work standpoint is to try to come to work even if you're not feeling 100%. But we've had to break that culture in Morris where people were coming into work sort of slightly sick. But we have to sort of change the culture, especially with the managers. If you have any symptoms of fever, cough, shortness of breath, GI symptoms, diarrhea, stomach ache, vomiting, just stay home. Don't try to come into work. That's just you're hurting yourself, and you're also going to be putting your neighbors and other employees and friends at risk of getting an infection or even COVID. So saying that, another big action is washing your hands, especially with soap and water. Soap and water for at least 20 seconds. If soap and water or a sink is not available, then hand sanitizer is your next step. At least having 60% alcohol in the solution and rubbing your hands with friction thoroughly. Saying about 10 or 15 seconds should be fine. Next, getting vaccinated. I know there's a lot of controversy on vaccines, but I think, as you can see since the vaccination rollout in January, that at this point that things have been able to open up slightly, whether it's businesses, whether social gatherings, whether it's just being able to travel too. Vaccinations have been a key to allowing businesses also to reopen, and now more churches are also reopening up. So that's the key. I'll be talking a little bit about that later. And then also COVID testing is important. Being that available, if someone has symptoms, if they they're not feeling good and they need to come back to work right away, 5 to 7 days after they're getting sick, and making sure the workplace's environment, that person should get tested. Actually, we had someone in our department last week who all of a sudden got sick and had a lot of COVID symptoms. Even though she had been vaccinated months ago, we had to test her because she shared an office with 2 other people. So that having testing available and doing that is also important. Now, promoting social distancing. I talked a little bit about the 6 feet social distancing in church or other venues. Social distancing, whether you may want to consider having families apart at least 6 feet from other individuals. Also, clergy, staff, and volunteers probably should follow the 6 feet rule to just decrease risk of transmission of COVID. Also consider holding services. This is a pretty large venue. Also, if there was windows that were able to be open or accessible, I would probably recommend opening windows during the summer to allow ventilation and cross air to come through. So that's one step. Next thing you may want to do outside, and we did that at our job, is having tape people coming in to have 6 feet distancing apart. You can do that. And also creating one-way routes into the sanctuary, and then one-way routes outside the sanctuary.
Dr. Bolden,
Mm-hmm.
Is it okay for you to hold the mic?
Oh, okay.
Just pull it.
Okay. Is that better? Is that better? Okay. Thanks. Next, promoting healthy hygiene practices. We've already a little bit talked about the hand washing for 20 seconds. There are videos out on proper hand washing. If you go on YouTube or other, computer apps that you can learn how to do that. It's not too difficult, in terms of hand washing, making sure you put the proper amount of soap and then lather it and friction, washing your fingers under your fingernails, etc. for 20 seconds. Also, encourage the next step would be, besides the hand washing, hand hygiene, encouraging staff and congregants that if you cough or sneeze, to cough into, the best method is to cough into your cuff or your elbow. Next step, if you don't remember to do that, just making sure you sneeze into the tissue, and then once you sneeze in the tissue, disposing it into a waste receptacle right away, and then washing your hands or using hand sanitizer. Also next, you may want to consider posting signs. We have that at the hospital, just reminding our employees to wash their hands 20 seconds. Some people sing the happy birthday song twice. That's usually 20 seconds, so you may want to remind congregants to do that. And then also wearing a face mask and properly covering your nose and your mouth. Okay.
It's on.
Okay, next.
It's not on.
Hello?
There's the power switch and there's the on switch.
It is on? Okay.
But it's on.
Okay, great. Okay. All right. Next, talking about intensifying cleaning and disinfection and ventilation. I've touched a little bit of.
The audio was low.
That's what he's.
Hold on a second, Doc. Because they're home here.
Try something.
Hello, testing.
Testing 1, 2, 3.
It's gonna be all right.
Okay, I think. Okay, that's good.
Yeah.
Okay. All right, let's go to intensifying cleaning, disinfection, and ventilation. Very important subject for the opening. I've talked to environmental in our hospital about this too. The main point that's pretty important here is cleaning and disinfecting high-touch areas, specifically doorknobs, rails, in terms of workplace, I don't know, people sharing computers, laptops, telephones in the office space. Other items in your workplace that that if you share with someone else, to make sure you disinfect those before starting to use. So that's an important thing. Also developing a regular schedule for cleaning certain rooms, whether it's a bathroom, whether if you're using a kitchen, that area too, making sure it's clean and disinfected each day. So just touching upon that, and then also making sure you have the proper disinfecting material. The EPA website has all the COVID-19 certified disinfecting agents that places use to disinfect. So that is an important website to check. And also when you do disinfect, following directions, whether it's how far do you spray the solution onto the surface, contact time in terms of how long you want to leave the solution on the surface, whether some solutions have a contact time of 2 minutes, some have contact times of 5 minutes, but making sure you follow direction, and then having the equipment, and whether, considering having, obviously cleaning with gloves, also the right, material in terms of wiping the surfaces. So, but following the manufacturer's direction for the disinfecting is important. And also making sure you keep them away from children. Next is taking steps to minimize community sharing of worship materials and lining, such as limiting. I know in Catholic churches they have a lot of the Bibles and a lot of those hymn and prayer books in the pews. So I don't think here. So just trying to minimize sharing prayer material by paper. May want to instead, when you're at service, using your app. When you're on the, Bible app, I do that at service. Also, if you were giving offering by envelope, maybe you want to consider switching to giving it online or the app, just to minimize transmission and contact, make things easier. Also within the church, I know at the very beginning of the pandemic, the choir, minimizing singing, especially when we didn't know as much about COVID. So if you do have a choir, I know some choirs now are together as long as they're vaccinated, but keeping the distance of 6 feet probably between choir members would be very important to do that. So, those are things that can minimize transmission with the church and makes things safer to open up. Next, hopefully, this doesn't happen, but, having a plan when a staff member or congregant becomes sick. So you want to advise those, if the person is sick, just as again say, stay at home. Self-monitor for symptoms. That's what we tell our employees. Make sure you don't have any fever, no cough, no shortness of breath, no loss of sense of taste and smell. Other GI symptoms such as vomiting, diarrhea, and also headache too is another thing we look for in our employees, and we tell them to stay home. Sometimes sinus infections now with the season with allergies, so that's important. And then if someone does get sick in the church, that's where some contact tracing is important. So you want to close off that area where that person has been at. And then after you close off that area, then you want to clean and disinfect. Ensure there's safe and complete application of the disinfectant, and keep disinfectant products away from children because they can breathe, and it takes much less for them breathing to get sick than an adult. So that's important. And then maintaining healthy operations, monitoring absenteeism from employee or staff at the church, you may want to designate someone at the church in charge of being a point person for COVID questions, for if someone gets sick, contact tracing, who were they around, while they were at church. How long they were around them, because usually for us, if they're around someone who happens to test COVID-19 within 6 feet and for longer than 15 minutes, we told those employees that they had to stay home. But things have sort of changed since the beginning of COVID. But since everyone is masked, then you don't really need to tell them to stay home, but they're supposed to monitor their signs and symptoms. And especially now, if that person is vaccinated, this is more or less now monitoring signs and symptoms versus at the beginning of COVID, where we told that person to stay home for roughly 5 to 7 days. And if they didn't have any fever or symptoms, then they could come back. So you want to have a point person just to be responsible for that. So next, signs and messaging. I think I talked about that a little bit already. Hand washing diagrams. In the church of washing your hands for 20 seconds. You may want to put them before you come to the bathroom. They could be in the hall. Just to remind people also, properly wearing a mask. That's another important item to address to your staff and the congregants at the church. And I'm just going to go over some statistics here in the city and in the county that I think are pretty relevant before I go to the next slide. As of late this week, the COVID-19 positivity rate in Chicago was 2.7%. The rolling positivity rate, which is a little bit better of what we as epidemiologists follow in infectious diseases, shows a more clear picture. That's like 3.1% in Chicago. Now, as I mentioned, we're in the bridge phase of the Illinois Department of Public Health, which means that for at least 11 consecutive days, the positivity rate has been under 8%. ICU bed availability has been more than 20% for over 11 days. And then there's been a consecutive 10-day decrease of patients' census in hospitals across the state. Terms of, I'm going to hit sort of on vaccinations. In terms of the U.S. population in the states is 61% white, 12% black, 17% Hispanic, and 6% Asians. In terms of those that have been vaccinated nationally, by population, it's been 62% whites have received at least one dose, 9% black have received one dose, Hispanic 13% have received one dose, and 6% Asians. So that also shows there's still a health inequality among black and brown populations. So I think that definitely needs to be addressed more fully. There's been improvement, but we still have a way to go in terms of getting the African American population vaccinated. Going back just a little bit to other statistics with Cook County, with the state of Illinois, which has done pretty well in terms of vaccination. For ages 65 and above, 80% have gotten at least one dose. Ages from 16 to 64 have
been 60% have gotten at least one dose of the vaccine. In the state overall, the state population is 12.7 million. In terms of the percentage of African Americans who have been vaccinated in the state of Illinois has been 9%, about 970,000 people. Hispanic has been about 1.37 million, about 12% of their population. And then in terms of Caucasians, it's been 62.1% of their population have gotten it fully vaccinated. So they are pretty much at the percentage of the population in the state. So they've been pretty receiving the vaccine and also been compliant pretty much overall. In terms of Cook County, the 65 and above age group, 82% of the population have gotten at least one dose. And then the 16 to 64 population in Cook County is about 61% have gotten at least one dose. Fully vaccinated in Illinois is 39.5%. In Cook County, fully vaccinated is about 42%. So the county is doing better than the average in the state. Approximately 2.47 million people in Cook County are fully vaccinated. In the U.S. as a country, it's 56% of the population have received at least one dose. 39% of the U.S. population is fully vaccinated. So to try to, I think the goal of trying to get to, quote, herd immunity is about 70%, 70 to 80% of the population. So we have a way to go, but I think that since Pfizer okayed teenagers getting a vaccine from 12 to 16, that just came under emergency utilization authorization last week. More and more teenagers are getting vaccinated, and that should help the percentage to go up. So, and then in terms of, I guess, the church, in terms of returning to the sanctuary, there's certain guidelines that the church is going to follow in terms of CDC and local government guidelines to open up for safe and secure worship experience. Some key points we want to talk about: those with immunocompromised systems, anyone uncomfortable coming back are still encouraged to worship with the church on the website www.cosmocommunitychurch.org. Secondly, there's going to be questionnaires. This is a CDC questionnaire in terms of asking you about your signs and symptoms. If you say yes to any of those questions, just stay home. Don't put anyone else in jeopardy of getting ill. That's what I tell our employees at the hospital all the time. Seating will be first come, first serve, in accordance with guidelines of CDC. With 6 feet apart, families can sit together. That's no problem doing that. Also, the church will be sanitized before and after services. Usually, I know in our conference rooms, when we had pretty big gatherings, it's usually at least 15 minutes. You want to leave 15 to 30 minutes between services to making sure that the surfaces give enough time to contact time to disinfect bacteria and viruses that could be laying on surface areas. And then also, of course, restrooms will be sanitized before and after each service and monitored for duration. And then some areas may be sort of restricted just for COVID safety protocols and procedures. And I think, you can see here that, what the directions are going to be, the procedures. Try to get to the church a little early, 10:15, for the 10:45 worship service. Also, ushers will direct you to seats and to maintain social distancing of 6 feet. All services will be held in the main sanctuary. Also, wearing a mask over the nose and mouth will be expected at this time. Should also be hand sanitizer you can use before entering the church. And then the CDC 5 questions we asked them at our job. Have you been in close contact with a confirmed case of COVID-19? Secondly, have you experienced any cough, shortness of breath, or sore throat? 3, have you had a fever over 99 degrees Fahrenheit in the last 48 hours? I know at our job, our threshold is about 100 for people. I just want to maybe make a little point here for testing during the summer. If someone comes in from outside and have a temp of 100 or 101, what we tell our employees you probably would want to do is have that person sit on the side for about 2 or 3 minutes, then retake their temperature, because they would give them time of cooling off from outside. Also, some people drink Dunkin' Donut coffee. We had it at our job. They coming into the building, their temp is like 101, 102. They're having a puzzled look, like, I feel okay, I'm okay. And then, we measure their temp, give them 3-5 minutes. It's 99, 98, so they're good to go to work. But that happened several times with us last year. So just a FYI to if someone comes in the building with an elevated temp in June or July, you want to do that, sort of falsely elevated. Next, have you had new loss of taste or smell? And the next question, have you had vomiting or diarrhea in the last 24 hours? And then follow directions of the greeters and ushers to be seated in the sanctuary. And then for offering, give your tithes if you can. You always go online or as you depart. That probably be the best method at this time. So, I'll just touch upon the 3 vaccines too that have been available to people. There's Pfizer vaccine, there's Moderna vaccine, and then there's the J&J vaccine. The Pfizer vaccine and the Moderna vaccine are messenger RNA vaccines, which means that basically there's genetic material that was taken that very similar to the COVID-19 inserted into messenger RNA, and then it's produced in your cells. So basically the cells give machinery to produce material like the COVID, the capsule of the COVID virus. So if that COVID virus enters your cell, into your body, that the vaccine acts as a way of basically protecting your body from the virus. It'll recognize that as foreign, and then it'll produce a bunch of antibodies. So that's how the messenger RNA vector vaccine works. And then for the J&J vaccine, it's basically an adenovirus vector vaccine, which means it's using adenovirus. They're using genetic material they put from COVID, take it and put it into this adenovirus. The adenovirus is then injected into your body. So the cells, again, produce capsid protein in your cells and building your immune system. So if that virus, the COVID vaccine virus, comes in, it'll be alerted that it's foreign, and then it produces antibodies. So that's how it protects you from the infection. As both of those vaccines, Pfizer and Moderna, pretty much 95% effective in terms of preventing deaths. also preventing severe illness and hospitalizations. And then they're starting to find out more now that it's sort of also decreasing asymptomatic transmission. There's still more experiments to be done, but that's what the research is showing right now. So, and I think in terms of the J&J vaccine, the difference in that is that it's a one-dose vaccine. Also, the effectiveness is a little bit less, 75%, but it also has been shown to decrease deaths, severe hospitalizations, and also asymptomatic transmission. So I think all those points are very important in terms of vaccine and also prevention of transmission for COVID. So I think that's about it. If I'll open it up for questions right now.
So are you recommending the others as opposed to the Johnson & Johnson? You said it was 75% effective as opposed to the others are in the mid-90s?
Yeah. In terms of a history of vaccine, I think all three of them are really good because my patients sort of asked me about that. I know that some people had some fear of needles and don't want to get stuck. So a lot of them, I know a lot of my patients some of them got the Johnson & Johnson vaccine because it was one dose. They wanted to get it done with, even though the effectiveness was a little less, but as long as they had a good immune system and also the vaccine was safe and effective. I know it had 8 cases where it caused blood clots, and that's why they had the pause. But when you're looking at 8 doses out of about 8 million, that's pretty safe, you know. So to answer your question, I tell people that whichever was available to them to go to get it because they all 3 were safe and effective. So I had no issues of recommending either one.
I'm curious, out of when it comes to vaccines in general, what's the
percentage? Yeah, like the flu vaccine, if you have a vaccine that's 50% effective, that's really good, actually, you know. And the flu vaccine, usually each year is about 50 to, it could be 40 to 50% effective. Really? So, yeah, so when these COVID vaccines came out with above 50%, it was a big accomplishment, you know, from a scientific standpoint, and a lot of the scientists were very pleased with it. So,
wow.
Yeah. So yeah, that's really good. Yeah.
We have okay. If a person has had 1 dose of vaccine, then they test positive for COVID, you know, before it's time for the second. When do you recommend that they take the second shot?
And can you repeat that question for the people on Zoom who can't hear her?
Okay. She just asked if someone has gotten the first dose of the COVID vaccine and they got a COVID infection, when would you recommend them to take the second shot? There's some different answers on that. There's 2 that usually I've read about. The first one is so wait about a month after the infection because now that you got 1 dose of the vaccine and then you got the infection naturally, you're going to have a really boosted immune system and antibody levels to COVID since you got the infection in the vaccine. So we usually tell people to wait a month because you want your signs and symptoms to be pretty much resolved before getting the second dose in terms of not having any residual effects, whether it's fever, A lot of people had some neural effects from COVID, including brain fog, forgetfulness, memory, some cognitive issues. So we usually told people to wait a month after the infection, and the reason, and also it does not affect how much protection you have against the vaccine or your antibody levels, because the first dose primes your immune system, where it's about up to probably 60 to 70% effectiveness. So if you got that amount, plus you have the infection where your immune system probably gonna be like 80 to 90% at least, and then you top that with a second dose of the vaccine, later your antibody levels are not gonna go down hardly at all. So we said that you can delay it a month, 6 weeks to get the second dose after you got the infection.
We have a question from Zoom. The question was, is HVAC cleaning mandatory? And if so, how often do you recommend that it be cleaned?
I don't think it's mandatory. I haven't heard it being like, quote, mandatory. I think it's definitely highly recommended. And in terms of changing filters and cleaning, I think it's probably, I don't know for sure, but I think it's similar to the home, in terms of getting your furnace, checked and clean in the fall, and then, another probably 6 months in terms of the ventilation, the air conditioning system in the spring. So,
thank you.
Are there additional questions?
No questions.
All right.
And then none online, we just
No,
got that
That's
one.
why I'm asking them now.
You want to prolong it? You can go ahead with the next
Yeah,
question.
let's go.
If a congregant comes in and we pretty much confirm that there is a reliable temperature.
Can you ask again? Starting again.
Okay, so if a congregant comes in and it's determined that there is a temperature, a reliable temperature, not impacted by
The
coffee
weather
or weather
outside.
or anything like that.
Mhm.
So we take them to a separate area and then kind of walk us through a scenario.
Okay. If that happens, want to probably make sure that person is stable enough, okay enough to go home, to drive themselves home. You want to make sure that, in terms of their mental state, and that they're okay, that they can drive themselves home, but and also making sure that in terms of exiting, probably want to exit them at an alternative, door or exit, not where everyone else is going through, at the hospital, and then obviously they go straight home. They, tell them, we told our employees, don't stop at the store, don't stop getting some groceries or whatever. You want to maybe have a neighbor or a friend to do that. Now, if you don't, then you may have to, stop at the store, especially having enough food to quarantine, or get your COVID test back before going back. So that's sort of, and then after they got home, we have like employee health nurse, or someone who works for the business to follow up and call them the next day to see how they're doing. So that's sort of what we did. And then in terms of bringing them back, it all depends, how their symptoms were. But if they were that sick, we usually had a low threshold to tell them they had to get COVID tested before they come back.
One more question from Zoom. The person asks if, after receiving the vaccine, can they carry the virus and infect others? I think you covered that, but can you reiterate?
Yeah, there's been some breakthrough infections, what we call it, where people who have been fully vaccinated and have gotten COVID-19. So, it's not 100%, it is effective and protective. It's all close to 100%. But I think the research is still out whether a vaccinated person can asymptomatically still spread virus to someone else. What we do know is that is definitely a decreased percentage of that person being able to spread COVID virus versus someone who is not vaccinated.
Another question. During the beginning of COVID, medical professionals wore PPE. Do we have to be concerned about individuals' clothing who have not been vaccinated and who have not been tested? And a follow-up, like I'm the girl who wipes all her groceries down when she comes in with bleach and water. So is that something we should be concerned about? For someone,
in terms of clothing, I think COVID can live on clothes. It can live on clothes without being washed at least 24 hours if someone has virus. Now, in terms of I know the question too is I know we had a couple of people at the hospital who weren't vaccinated. We did not put those types of people in terms of checking the temperatures for screening and all that because, their risk of being asymptomatic carriers of COVID or not knowing they may have COVID, pre-symptomatic is much greater. So, in terms of that, would you have to worry? I think if you have monitor your signs and symptoms and all that, they're probably not going to be a high risk, but they're definitely more risk of transmitting to someone else who, if they're not vaccinated versus someone who is vaccinated.
That's a part B.
The
person also asks about the bathroom usage. Should the stools have to be sanitized?
Oh, now if you have a person in the house who got COVID, what we told them, the bathroom would have to be sanitized. We usually told employees to have your own bathroom, designate that you the only one using this particular bathroom if they couldn't go to an alternative site, like an uncle or aunt's house while they were quarantining with COVID, or even a hotel. We had hotels reserved for some of our employees who came down with COVID during the early part of the pandemic, and the hospital paid for it, yes, in terms of the stool and all that being sanitized, you should sanitize that bathroom. Yes, that person should be designated their own bathroom. And then thirdly, if that person is really, if the headquarters or the quarters are tight and all that, it'd probably be best to try to go to a relative's house, if that relative is okay with it or allows you to do that, to just decrease the amount of spread in the family, because we had multiple family members, once one employee got infected almost the whole household, or at least someone else. So,
Yeah. Another question. Have you heard anything about the Indian variants being prevalent in the U.S.? And if so, have any cases been found in the Chicagoland area?
I haven't heard about the variants yet from India getting into this area. I wouldn't be surprised. It's a matter of time that you may see a few. I know probably hospitals are probably preparing to be able to identify those in the lab, especially the bigger hospitals like Northwestern, U of C, Rush, and then in terms of the other variants that are out there, we still, have to be alert for those, especially the UK B117 and also the Brazil P1 variant. Those are out there that we're monitoring right now. I have several colleagues from India who have relatives in India, and they've talked to me about the conditions over there, and in terms of the healthcare system, it's definitely not as well or advanced as here. And also with this summer with international travel, people who have relatives in India, which could make it possible for it to get over here. Eventually, I wouldn't be surprised if it does. But from what I understand, that variant in India is pretty transmissible. So the answer to your question probably is I don't think we know for sure. It could be over here as right now. We just don't know, but it's probably a matter of time this summer where you may start seeing cases.
Okay. There are a couple more questions. The first one, for vaccinated adults who are around children who are not vaccinated, as such as a caregiver or a teacher, what are your thoughts about safely coming back to the sanctuary when you're not sure about who is vaccinated, even though they have on a mask?
Oh, okay. In terms, I guess the first part with the children, I think it's good that the adult is vaccinated because the adult is probably more mobile, probably going to interact a little bit with more people because you got to go to the store and shop and other social venues. I'm not saying that children don't have a bunch of social contacts too, but I think it's more adults may have more social contacts than children. The thing with children too that is probably a positive is that children, for some reason, children do not get as sick, it seems like, as adults over most cases that, if they do get COVID or they are coming in contact with someone who's asymptomatic, they tend not to get as sick. Could the kid still be carrying silently? Yes, he can carry it silently. So I think you sort of got to go sort of by a case-by-case basis with a risk-benefit. Now, if you have a pretty good immune system and it's normal, you don't have any immunocompromising conditions, such as lupus, rheumatoid arthritis, cancer, chemo, dialysis, maybe radiation treatment with cancer, HIV, hepatitis B or C, organ transplant, stem cell transplant. If you've had one of those, then you probably may want to consider remote if you're really worried about coming in contact maybe with a either unvaccinated person or a kid, a child who can be a carrier and you don't know. And then in terms of mask wearing, I mean personally, I'm gonna probably be wearing a mask no matter what, going into the stores, a crowded area. That's probably not gonna change for a long time, So I mean, we've seen that, masks have decreased the transmission. I mean, there's studies out there. There's, multiple studies, JAMA, New England Journal of Medicine, who have, have shown the evidence is pretty much convincing. So, I mean, masks decrease transmission without a doubt. So if that person, if that person wants to come back to the sanctuary, have concerns, with their immune system, and if they've been vaccinated, I probably, and with a mask, I probably wouldn't be that concerned at all.
Okay. And then I think this is the last question. Is it the recommendation that people still quarantine after traveling to some parts of the country, for example, Florida?
No, CDC CDC said you don't have to if you're vaccinated. That's been the big change with CDC in terms of its domestic travel within the country. You do not have to test and you do not have to quarantine. So if you're fully vaccinated, which means you've received your second dose 2 weeks, 2 weeks prior, at least 2 weeks prior to you traveling. Now, international travel, also with the CDC, you don't have to quarantine, but now, you have to have a negative COVID test before coming back into the country. So in terms of quarantining for international travel, you don't have to do that. That's fully vaccinated people. So.
Thank you.
Okay.
I've got one more question.
How is the hospital addressing individuals or finding out their COVID, whether they've been vaccinated? Is it strictly the honor system, or how are they determined?
That's a good question. Because we started allowing visitors to come back, I think, mid-March, and that came up because our visitors have to wear masks when they come into the hospital, no matter vaccinated or unvaccinated. Now, I guess in terms of someone outside the hospital, like in Morris, it's pretty much like at Walmart, because in Morris or some of these other places, they're now saying that, hey, you don't need to wear a mask entering our building, so you're wondering, someone is like in the aisle, are they vaccinated? Are they unvaccinated? And all that. Those people without a mask, you really don't know for sure unless no one's going to really volunteer that information to you. So I pretty much would say, if I don't see someone with a mask, I'm going on. I'm not an assumption, but I'm saying to myself, there's a possibility this guy ain't masked, so I'm going to keep my distance, from them, no matter what, so. And actually there was a poll a week ago saying that, the percentage of people who are masked, who are unvaccinated, tend about I think 60% of them that are unvaccinated not wearing masks, and the percentage of those that are COVID vaccinated is about 65 to 70%. Those are the people that are still wearing masks versus those that are unvaccinated. So I think it's just the people who have the attitude of being unvaccinated, they tend to be some of the reasons that they not wearing masks and not vaccinated. The reasons tend to be they not thinking that the virus is serious. They also think that they're not going to get infected, or if they do get infected, that it's not going to seriously harm them or kill them. But where I've worked at, that was definitely proven wrong, and some families really regretted it, in the hospital.
Wow.
Yeah. Yeah, I think actually the peak census we had at our hospital for COVID was 45. We have 95 beds in the hospital, so we almost had half of it filled up with COVID this winter, I think January, February. This last Friday, believe it or not, we only have one person with COVID in the hospital now. So, I mean, it's come a long way.
Any other questions?
One question for the ones on the Zoom, they're gonna get a poll.
You have a question?
Well, can you hear that?
This is related to the so-called long haulers, the people that's had COVID and recovered, but they're still having extreme symptoms and they never got back to being the old selves again. Is that due to some type of pre-existing condition, or is there something that happened when they contacted COVID that degraded their body while they can't recover at all?
I know that they're doing research on long haulers, especially at Northwestern right now, and I think that we don't know the exact answer, but there's been they really believe that the immune system, the regulation of the immune system has been disturbed by those that have long hauler syndrome, whether it was brain fog. I mean, those have been the ones that have been studied: brain fog, fatigue, memory loss, just not being able to focus too. Concentration has been disturbed. Another long haulers that we saw in the hospital, and even staff, has been lung issues. A lot of people saying they were used to exercise and run. Now that they can't really do that for just a few minutes, 5 minutes maybe. So, in terms of what the reason why the symptoms lasting longer than a month, even 2, they think it could probably be due to the immune system being disrupted, not regulated like it was before. And it was interesting that I think a few months ago that some of these long hauler patients got vaccinated, and actually right after the vaccination, a week or 2, their symptoms had improved quite a bit. So that sort of gives an idea too that the immune system is a big part of why these people continue to have these symptoms. And maybe also there's other COVID treatments that have been used on the long haulers that they did show improvement. I think they'll probably know more about this probably later this year, like why they having these symptoms and what they can be used to treat.
Okay. I just got one other question. I don't know if the doctor is.
No, we need a mic so people can hear you, D.
Yeah.
The CDC was saying that possibly around October. So,
You said green light? You said green light?
Yeah.
okay, the CDC was saying that possibly around October, Pfizer, Moderna, and some of the other drug makers were saying we have to have a booster. Even Johnson & Johnson said instead of the one shot, they're going to put out a booster. And they were saying that, CDC was saying that the shots, people that had 2 shots, they're good for about 6 months. And then the drugs makers say that we're going to have a booster sometime in October, November. Suppose that come October, November, your booster is not available. You know, the government ran out of money, or now your shot, your immune system is getting attacked again because no longer your 6 months is up. You don't get no booster. I mean, what are you going to do then? What are the probable solutions? I don't know if you know the answer, but I'm just throwing it out there.
Yeah, I think I'm feeling probably in the fall that boosters, are probably going to be, is going to be recommended. I think I think the drug companies already have those things rolling. They just haven't got it out there yet. I think also, I think next year too, there's probably going to be, if people have COVID, there's going to be some more treatment modalities out there. But in terms of the boosters, what I do have heard, and on the horizon for the boosters, what you're saying, the government may not be covering the cost for the boosters. It's probably going to be up to the person, the consumer, or whoever, us, is going to have to pay for those out of insurance. So when you say in terms of availability, I think they'll be available, but I think that the government's gonna, the money will run out of, covering costs for these vaccines, so you're gonna have to pay for them through health insurance,
Any more questions?
Okay.
Come on, can we thank God for Dr. Bolden spending time with us? Thank you. And so we're going to have Pat Jackson, who's head of our Nurses Guild. She's going to go over a few things with us.
Okay.
Thank you, Dr. Bolden. You pretty much covered everything that I was going to say. What you can expect when you come back in June. I'll just reiterate it again that we will arrive for screening at 10:15 we will begin for the 10:45 worship service. And you will be directed to maintain 6 feet safe distance as you move through the process. All services will be held in the main sanctuary. You should wear a mask that covers your nose and your mouth. And you must use hand sanitizers upon entering the church. To answer, when you walk in, there will be a board up that the nurses have provided, and you will be asked the 5 CDC questions. Have you been in close contact with a confirmed case of COVID-19? Are you experiencing a cough, shortness of breath, or sore throat? Have you had a fever, a temperature over 99 degrees in the last 48 hours? Have you had a new loss of taste or smell? And have you had vomiting or diarrhea in the last 24 hours? Please get your temperature checked. If it's 100 or more, we will ask you, as Doctor said, to wait a few minutes in case you had a cup of coffee. But if it's still up, we would ask that you go home and come back next Sunday. Follow the directions of the greeters, ushers, to be seated in the sanctuary. Give your tithes and offerings, and then depart the sanctuary. Any other questions or concerns? Pastor Clark.
Okay. Thank you. So, they've already done the poll? Is that safe to say?
It's done.
Wonderful.
Keep moving.
So everyone, we thank God for Dr. Bolden. We thank God for our Nurses Guild. The only way that we're going to get through this is together as a community. The only way that the plan works is if we all cooperate. And this will probably be our norm until further notice. So we got to be prepared to get here early. As always, we've stated that if you're not comfortable, continue what you're doing. Stay home. The church is going to make sure that we cover you accordingly, like we've done over the last year or so. Communion, for those that will be coming, communion will be distributed as you walk in the door, so we're not double handling. Know that our deacons, our ushers, our greeters, are doing whatever we have to do to make sure that everyone is safe. I believe that's the majority of the things that we want to cover. Janet, is there anything else you can think of before we dismiss?
Just ask the people online if they will participate and respond to the
Survey.
to the poll. That would be helpful to us.
Okay, the survey, the poll, we're asking that everyone would respond, fill in yes or no. And then there may be some, I don't know, you handed out people in here in case?
Yes.
Right. So we need the information. It's not just because we want to do paperwork, but we need the information. It helps us to better. And then also, if you have questions after the day, reach out, call the church office. We know 773-536-3610. Call the church office, and then we will get some answers back to you. We want to make sure everyone is safe. I believe that covers everything. We have had a wonderful day of worship. I look forward to June 6th when we reopen. Bring your love, your shouting shoes, your praise, your worship. I'm excited about what God is doing. Things are different, but different just stretches us so that we can be better. Once again, thank you, Dr. Bolden. God bless you. And we love you. I'm going to pray and we're going to dismiss. So eternal God, our Father, we thank you for our time together today, Lord. We thank you for every listener, every viewer. Father, we thank you for Dr. Bolden, our Nurses Guild, for every person that worked to make this day a success, Lord God. We ask that you would bless them, meet all their needs, their wants, and their desires according to your riches and glory. Father God, even as we prepare to leave this place but never your presence, we thank you for traveling grace, arrival, mercy. We thank you that angels have been dispatched over the highways and the byways, and that you'll bring us together again at the appointed time. We love you, and we declare all these things done in your Son Jesus' name we pray. Amen.